Thank you very much, Stavros, for joining us this Saturday morning. So it's been a long battle for African countries, especially to get access, equitable access to vaccines. A lot of richer, wealthier countries, developed countries buying up large stocks of vaccines, and we have to be happy with the scraps at the back of the supply chain. What does this mean now, just in terms of availability of vaccines for rollout, not just in South Africa, but across the continent?
Anit, firstly, thanks for having me on your show, and good morning to all your viewers. The pharmaceutical industry has been at the forefront of fighting the pandemic, and of course it does so by supplying and providing sustainable supply chains for both therapeutic medicines, diagnostics, and also vaccines, which is a more preventative measure. Your question is directly aimed at vaccines. Of course, we know that the best form of cure is prevention, and that is exactly what vaccines do. We've seen the devastating impact on both lives and livelihoods during the pandemic, and we also have a burgeoning chronic disease burden in our country. So ensuring a sustainable, reliable, and durable supply chain of vaccines is critical to, firstly, saving lives in our country, and then secondly, restoring the economy. So the best economic policy we can possibly have right now is to vaccinate as many people, as many South Africans as we can. But then the question that you pose to me comes to the fore of that. Are we able to equitably receive and distribute vaccines around the world? And the answer is no, because we can look at the facts. 3.8 billion doses of COVID vaccines have been administered globally, and Africa has received around 50 million of those. So you can work out the arithmetic. There's a gross inequality here. And the only way to solve that inequality is to develop local capacities. So we've seen two multinational companies in the form of Johnson & Johnson collaborating with Aspen to build capacity on the continent. And then we also saw earlier this week the announcement of the Biovac, also a South African company, collaborating with Pfizer, also to in time produce vaccines in South Africa. And both of these initiatives are to provide vaccines to the continent, to bridge that inequality gap in both supply, distribution, and administration of vaccines. So these are all very positive developments. And, you know, the old mantra that if you want to do something, if you want to get something done, do it yourself, can not ring any truer than through building our own vaccine capacity on the continent.
Stavros, now obviously local is the key word here. We're going to be manufacturing them locally. Big pharma also means big money. So while trying to stimulate the economy by getting people vaccinated so they can get back to work, this also helps to stimulate the economy in the sense that the money for the vaccines is not going outside the country, it's staying here. What are the economic impacts of this decision to manufacture locally?
Look, I think we've got to work off the premise that a healthy nation is a productive nation. And we've seen that through this pandemic, and even prior to the pandemic. You know, South Africa has a disproportionate disease burden, the worst of infectious diseases, and then also a rising tide of what we call non-communicable diseases like diabetes, cardiovascular disease, and others. So we were already on the back foot before we went into this pandemic. And the pharmaceutical industry is at the heart of, firstly, assisting to get the productivity levels up by establishing a more healthy nation. The numbers are really atrocious when you look at them. We've got this quadruple burden. So that's the first thing you need to do. And pharma is central and pivotal to that. A healthy nation is a productive nation, allows you to compete globally. And then secondly, pharma is also at the center of stimulating economic recovery and growth in our country. We've seen that in net terms, we've shed around 1.6 million jobs None of us know what the fallout of last week's events, the rioting and the looting, is going to be. But pharma is certainly critical through a wide and mass vaccination campaign in getting the economy back on track by opening up the economy as other economies have done globally. And I think that's been, for me, one of the biggest disappointments, is that those nations that are wealthiest have tended to vaccinate huge swathes of their population and consequently have opened up their economies quicker than we have.
Stavros, I do apologise. Unfortunately, we have run out of time. If I could quadruple the time with you, I would, and carry on chatting. Unfortunately, we have to let you go. Stavros Nicolaou from the Pharmaceutical Task Group speaking to us about the fact that Pfizer is now going to be manufactured here locally in South Africa and distributed to the continent.